Foot and mouth disease, FMD, a highly contagious viral disease affecting livestock, was first identified in the 16th century. The earliest known detailed description of the disease dates back to 1514 in Italy. However, it was not until the 19th century that the disease was studied more thoroughly. The causative agent, an aphthovirus, which is a type of picornavirus, was first discovered and isolated by Friedrich Loeffler and Paul Frosch in 1897, marking a significant milestone in the field of virology. This discovery was particularly noteworthy as it was the first time a disease was attributed to a viral agent, helping to establish the field of virology. Foot and mouth disease, FMD, is a highly contagious viral illness primarily affecting cloven-hoofed animals, with several routes of infection that facilitate its rapid spread. The most common mode of transmission is direct contact with infected animals, where susceptible animals are exposed to the virus through blisters, saliva, feces, urine, and milk of those infected. Airborne transmission also plays a significant role, especially in confined spaces such as barns or during animal transport. Under certain climatic conditions, the FMD virus can become aerosolized and spread over considerable distances, presenting challenges in disease control. The disease can also be transmitted via contaminated objects, or fomites, including equipment, clothing, vehicles, and other objects that have been in contact with infected animals. This highlights the importance of stringent biosecurity measures in managing an outbreak. Movement of infected animals or animal products, such as meat and dairy, is another critical pathway for the spread of FMD. This is why there are often strict controls on the transport of animals and animal products from regions experiencing an outbreak. Interestingly, while humans are not susceptible to FMD, they can act as carriers, inadvertently transmitting the virus through their clothing, shoes, or equipment. This aspect underscores the need for thorough hygiene practices in affected areas. Additionally, in some regions, wildlife like wild boar can harbor the virus and contribute to its transmission among domestic livestock. This interplay between wildlife and domestic animals complicates control and eradication efforts. The combination of these transmission routes makes FMD a particularly challenging disease to control and necessitates comprehensive strategies including biosecurity, surveillance, and vaccination to manage its spread and mitigate its economic impact on the agricultural sector. Foot and mouth disease, FMD, is a highly contagious viral illness that significantly impacts livestock, especially cloven-hoofed animals such as cattle, pigs, sheep, goats, and deer. The disease is characterized by a range of symptoms that cause considerable distress and economic loss in affected animals. A high fever often marks the onset of the disease, serving as an initial sign of infection. The most distinctive symptom of FMD is the appearance of painful blisters or vesicles in and around the mouth, on the tongue, lips, gums, and inside the cheeks, as well as on the feet, teats, and udder. These blisters are not only painful but also interfere with the animal's ability to eat and move comfortably. Excessive drooling and foaming at the mouth are common due to the mouth blisters. Animals with blisters on their feet exhibit lameness, which can be severe, making it difficult for them to walk or stand. This can be particularly distressing for the animal and challenging for farmers managing the livestock. The disease also leads to a decrease in appetite and subsequent weight loss, as the pain from the mouth blisters makes it difficult for the animals to eat. In dairy animals, a significant drop in milk production is a notable consequence of the infection. The ruptured blisters can lead to open wounds, which are susceptible to secondary infections, adding to the animal's discomfort and recovery challenges. It's important to note that while the severity of symptoms can vary, with some animals exhibiting mild or even no symptoms, they can still be carriers of the virus. This aspect of the disease makes it challenging to control, as asymptomatic animals can continue to spread the virus. Foot and mouth disease, while not typically fatal to adult animals, can cause severe productivity losses in the agricultural sector. The disease can be more severe in young animals and may sometimes lead to fatalities. Due to its highly contagious nature and significant impact on animal health and farm economics, FMD remains a major concern in livestock management and agricultural practices globally. Foot and mouth disease, FMD, is a highly contagious viral infection in livestock, and its management is focused more on prevention, control, and containment rather than direct treatment of individual animals. Effective management strategies for FMD involve a combination of vaccination, stringent biosecurity measures, movement controls, and sometimes, culling of affected herds. Vaccination plays a crucial role in preventing and controlling FMD, particularly in endemic areas or as an emergency response during outbreaks. The effectiveness of vaccines, however, depends on the compatibility between the vaccine strain and the circulating virus strain. Despite their usefulness, vaccines are just one part of a comprehensive control strategy. Quarantining infected and at-risk animals is essential to prevent the spread of the virus. Movement controls are also critical, especially in outbreak regions, to restrict the movement of animals, animal products, and even vehicles and people from infected areas. These measures are vital in limiting the spread of the disease to new areas. In severe outbreak scenarios, the culling of infected and potentially exposed animals may be necessary. This extreme measure is taken to quickly contain the virus, and the disposal of culled animals must be conducted under strict biosecurity measures to prevent further spread. Implementing rigorous biosecurity practices on farms is a key preventive strategy. This involves disinfecting facilities and equipment, controlling access to farms, and ensuring hygiene protocols are strictly followed to reduce the risk of virus transmission. Continuous surveillance and prompt reporting of suspected cases are crucial for early detection and response. Quick implementation of control measures upon detection of a case is essential to contain and limit the spread of FMD. Supportive care for affected animals includes ensuring access to water and food, given that painful mouth lesions can make feeding difficult. Management of secondary infections is also a part of supportive care, although it does not treat the FMD virus itself. Effective FMD management also requires international cooperation and adherence to guidelines set by organizations such as the World Organization for Animal Health, OI. National policies play a significant role in determining the specific strategies used in different regions. Overall, the approach to FMD is largely about controlling its spread to prevent significant economic losses and to ensure animal welfare, as there is no direct cure for the virus itself. The focus is on a collective effort to maintain livestock health and protect the agricultural sector from the impacts of this disease.